This is Arklatek's People in Politics Sunday edition. A look at the issues and decision makers shaping the Arklatex and the nation. Presented by KTBS.
Well, hello everybody, and welcome to the app on Sunday. I'll be your host. My name is Jeff Beinfor. We appreciate you being with us. Now, for the past year, we've been presenting a podcast online, the app, Arklatek's People in Politics, talking to all the movers and shakers in Arklatek's politics, but it's been quite successful. So we're transitioning into the next logical step, and that's to go into a full-blown television show mode on Sunday mornings. We'll be coming to you every Sunday morning from 9 to 9:30. And we are going to be doing some different things on this program. One of the things we're going to be doing is having a rotating series of co-hosts. Let me introduce to you our first co-host, and that's Louis Avallone from American Ground Radio. Louis, just quickly, a little bit of your background.
Yeah, no, absolutely. You know, I'm born and raised right here in Shreveport. I am the first generation son of an Italian immigrant, so I've had a front row seat to the American dream my entire life. And of course, a few years ago, we started a radio show called American Ground Radio, celebrating all those ideals that made this country great. And so now we're in over 45 markets, including New York City. And of course, also served as the chairman of the Caddo Parish Republican Party for the last 10 years.
All right, very good, Louis. We'll talk more with you in just a minute. Now, our first guest on the initial episode of the app on Sunday has been a very busy man. To give you an idea of how busy, here's a montage of Louisiana Senator Bill Cassidy with various presentations on and off the floor of the United States Senate.
Democrats want to cover the cost of health insurance to benefit insurance companies. And I will tell you why I'm saying that, because I can make that case. And Republicans want to cover the cost of health insurance for the actual person buying the insurance, the patient, if you will. Republicans and the Democrats agree every worker deserves to retire with dignity and financial security. Congress should help workers access consistent, secure retirement income by improving access to lifetime income products, which allow workers to own and tailor their accounts to what works best for them, rather than having a one-size-fits-all. Democrats are advocating to send $26 billion to insurance companies so that you subsidize plans, silver-level plans, which have a $6,000 deductible. I've asked people who've asked me about this, do you have $6,000 in your bank account to spend on health care before the insurance actually kicks in? Not one has yet raised his hand. There are 100,000 Americans waiting for that medical miracle called transplantation. We cannot fail them. 100% of the money she receives goes towards some sort of health care or dental care or vision care. By the way, that's a distinction. Under the Democratic plan, the insurance company doesn't cover your dental work. They don't cover the orthodontia for your child. They don't cover the eyeglasses you need. And under what we're doing, put it into our pocketbook, physician, dentist, drugs, vision care. This is a patient-driven account of which 100% is going to the care she knows she needs, and she does not need to seek permission in order to obtain. Pleased to announce the $208 million coming to Louisiana for Rural Health Fund. $208 million, and Louisiana is receiving more than our fair share. That was part of the Working Families Tax Cuts Bill, or the One Big Beautiful Bill. And that One Big Beautiful Bill took care of rural hospitals, which means helps take care of the health of our fellow Louisianians who live in rural areas.
All right, Senator Bill Cassidy, been a busy guy. Louis has joined me at the wall now. Senator, thanks for being here on the app on Sunday. We appreciate it.
Hey, I'm glad to be with y'all. What a great vision. What a great completion. Now that you're on TV, I'm glad to be numero uno, as they would say in Louis's father's home country.
Yeah,
there we go.
They definitely would. Look, this is going to be a really busy political year, a big election year. You're running for re-election. It's become a pretty crowded field. Can you talk to us about that a little bit?
Yeah, open up the phone book. There's my list of opponents. But we're going to run on my record. You know, you talk about infrastructure. I think I'm over $13 billion in money that I have brought to our state for infrastructure. I went through Bossier Parish about, 8 months ago. They had 5 different projects they could point to for infrastructure spending that I have brought to this state. The latest announcement is, I think, $1.3 billion coming to our state. Jeff Landry announced it, approved by the Trump administration, but money that I was able to get for our state to make sure that everyone has access to high-speed affordable internet. Lastly, I'll just speak about the tax cut for working families bill. No tax on tips, no tax on overtime, no tax on Social Security, stuff that I have brought to this state or delivered for our nation. I can keep going, working with President Trump closely. I'll run on that record and we will win.
I do want to talk to you more about infrastructure and all the money you brought to Louisiana in a second, but that crowded field, look, there's a bunch of people in that race. You know that. You said open up the phone book. Of course, they all want to take their shots at the guy who's currently sitting in the chair. How do you respond to that?
Yeah, the water's warm. Come on in. But again, I'm running on a record, and I'm running on a record of supporting President Trump's agenda. He's got 3 cabinet secretaries he would not have had I not gotten them through or cast the deciding vote. There are provisions in the tax cut for working families bill that the president is bragging about. For example, the first provision that goes along the lines of school choice, that was my bill. One more thing, he had a nice ceremony in the White House to sign into law a bill I wrote called the Halt Fentanyl Act, giving law enforcement more tools to fight the drug smugglers. As he signed it into law, I'm standing directly behind him. He says this will be one of the most important bills I sign. I'll run on my record of supporting President Trump, of him being pleased with my work and doing things for our state and for our country.
And so your relationship with the president right now, you consider that to be pretty good?
Yeah, we're working very well together. I think I've been invited to the White House 15 times in the less than year that he's been in office. At times, for example, when LSU Shreveport and LSU Baton Rouge were there for the ceremony, oh, there's Bill Cassidy. He's our great senator from the state of Louisiana. So working closely together, again, working for our state and working for our country.
All right, we're going to take a break because it's Sunday morning, but we still have to make some money and pay the bills on a Sunday morning. So we'll continue our conversation with U.S. Senator Bill Cassidy coming up right after this. And we are back to continue our conversation with United States Senator Bill Cassidy of Louisiana. Lewis, what you got?
Yeah, so Senator Cassidy, a few months ago on American Ground Radio, you indicated that you believed that the President Trump, would not endorse in the United States Senate race, in your United States Senate race in 2026. Do you still feel that way?
Yeah, absolutely. His political people have told me the president likes our working relationship. I think he's going to stay out of our race. And so, frankly, because I've been working for the president, and you can look at the proof of us working together in terms of things that he's continued to accomplish. So I think the president wants to continue that relationship, and that's what his political people tell me.
All right, listen, for those who don't know, you are a physician in addition to being a United States Senator. I tell this story all the time. You're probably tired of me telling it, but 3 years ago when the COVID the pandemic was at its height, I was really sick and in the hospital, and I don't know how you found out about it, probably through a member of your staff. You called me while I was in the hospital to make sure they were taking care of me. You said, hey, are they doing this? Are they doing that? Look, man, I really appreciated that, Senator. You didn't have to do that. So, again, I thank you for that.
I've been a doctor a lot longer than I've been anything else as an adult. And so, Jeff, you just notice things. By the way, there's a guy in Livingston Parish, and once we're on the campaign trail, and he had a little bump right there. And I said, man, can I speak to you personally? He goes, yeah. He goes, that could be a cancer. Go check it out with your family doctor. So 4 years later, we run into each other. He goes, Doc, you remember me? It turned out that was a cancer. You saved me from having a worse case. So anyway, you're doing great, but believe me, it is just something that you do when you're a physician. You want to connect with people that you know, and you want to make sure that they're healthy.
Well, that was great. And let's talk a little bit about healthcare, because it's clearly it appeared to be at the center of the federal government shutdown. The Obamacare subsidies have now expired. And is there a way to solve all this? And is there another federal government shutdown looming?
Well, I think there is a way to solve it. I've been working on it over the break, working both with my Democratic and Republican colleagues, but also with the White House, speaking to Dr. Oz, for example. And the president wants to, and I totally agree, you got to give the power to the patient, not the profit to the insurance company. And Democrats have wanted to give $26 billion to the insurance companies, and they take 20% off the top for profit and overhead. But if you give the money to the patient, she's going to spend 100% of it for the health care she knows she needs. And you don't have to force her to do that. You give her a choice. Do you want the policy where the insurance company gets 100% of the money and takes 20% of it for profit and overhead? Or do you want 100% of the money in an account you control? That's my goal. The president, that's where he is. We're totally together on this. As a doctor, I know it works for the patient's health when she has power over her pocketbook and power over her health care decisions. And so that's what we're working for. If we get a solution, it'll be centered around that.
Senator Cassidy, of course, being a physician, you were a big supporter of RFK Jr. Do you still feel as enthusiastic about that relationship and the fact that you did vote to confirm him? Is that relationship still the same?
You know, the RFK has worked a lot on ultra-processed foods, and I have to hand it to the fellow. Ultra-processed foods are something which the support I heard from people for his nomination was typically centered around that. It had not been addressed before. We clearly differ on immunizations, and unfortunately there have been people dying from vaccine-preventable diseases, and there's been a kind of a confusion that's been spread. So we'll continue to disagree on that, and I, as a physician, who once sent a patient on an airplane to Shreveport to get a liver transplant from a vaccine-preventable disease, understand the importance of preventing that disease and any other disease in which you can prevent with a vaccine. I'm all about making America healthy again. Part of that is to keep people from dying from vaccine-preventable diseases or needing a liver transplant in the middle of the day because of that.
All right, Senator Bill Cassidy, you're also the chairman of the HELP Committee, Health, Education, Labor, and Pensions, which I always thought was a weird combination. Talk to me a little bit about running that committee.
Hey, it's a great opportunity. Again, health is all, how do you make health care more affordable? We're trying to make drugs more affordable from a piece of legislation that we almost passed last year and hope to pass again this year. We're working on price transparency so that when the patient, when the family goes in to see the doctor or to get an x-ray, they know how much it costs before they get it. They don't have to figure it out later. And when you know before, you can shop and get a better price. Power to the patient. Education. I've already talked about how I've been able to promote school choice, and the president has thoroughly endorsed that. Now he brags upon the fact that we got school choice opportunity through there. Labor. How do we allow somebody to, say, for example, someone, a gig worker, who may be a Uber or a Lyft driver, but it may be a chemical engineer that works for this company and that company. How do we help them plan for their retirement in our new economy? All those things are important to me, and that's labor and pensions. All those things are important to me because they're important to the people I represent. As chairman of the committee, I have more influence on that, taking the lessons from Louisiana, applying them to national policy to benefit people in Louisiana and people across the country.
All right, lots more to discuss with Senator Bill Cassidy of Louisiana. We'll do that coming up on the other side of this break. All right, we are back with more of the app on Sunday, and Senator Bill Cassidy is our special guest. And Senator, there's been a topic, very hot conversation in the state of Louisiana. Lewis, hit it.
Yeah, no, absolutely. You've spoken many times about carbon capture sequestration and about all of the money that you have brought back to Louisiana for carbon capture sequestration. A lot of folks feel like that's a boondoggle in terms of there's really no marketable, product there. I mean, it's not a toxin in terms of pumping it under the ground, although it can pose some health risk. to folks living in that area. Why are you such a proponent of that process?
So let me push back a little bit. I've not actually brought money back to do this. It is the companies who are investing on their own that are doing that. Number one. Number two, if a local community does not want it, don't do it. Yeah, the local people should have the final say-so. But if you're like Southwest Louisiana, in which there's been, I don't know, tens of billions of dollars invested, creating lots of jobs and increased property value, therefore more property taxes from the businesses paying to the city and to the parish, they want it. Let them have it. And why would you do it? Just today in Europe, they begin something where they will tax products based upon their carbon footprint. So if you're a BP pumping natural gas out of the Haynesville and you want to send natural gas to Europe and get the best price, then they're going to do something to lower their carbon footprint. It ain't me saying it, it's the big corporations saying it who are providing our jobs. If you don't want it, don't get it. But if a company wants to be more competitive selling their goods in a place like Europe, they have a vested interest. And they are the ones spending the tens of billions of dollars. It ain't me, it is them. And why would we stop them? Unless the locals don't want it. If the locals don't want it, don't do it.
Hey, Senator, I wanted to ask you about, how bureaucratic Washington can be, better than I do or Lewis does. You've been able to bring a lot of money back to the state of Louisiana. How hard is that process?
Yeah, it depends. If you're actually willing to get in there and work hard and roll up your sleeves and take criticism. I get criticized for bringing money back to Louisiana. One example, congressionally directed spending. People will say, oh my gosh, he's done congressionally directed spending. Well, how it works is that Congress puts a certain amount of money and they say it's going to be spent on projects in local areas. Go for it. Some people are too pure. Oh no, I'd rather that money go to Texas, to Arkansas, to Mississippi, to Florida, than to come to our state because I don't want to fight for it. Wait a second. If you're not going to do it, that's fine. But if you're going to do it, if you're going to put money out there to spend, I want it to come to my state. I want to fight for that money. Because of my fighting for that money, we've gotten extra money for Barksdale, for both the upgrade their capabilities, but also to upgrade the way that we take care of the airmen, the airwomen, and their children. It would not have come to our state had I not fought for it.
Yeah, no,
I'll also
absolutely.
say that there was a project in which I get a phone call. Hey man, I'm a congressman from Cincinnati, and we want Department of Defense to begin to evacuate people hurt in the battlefield to come to the United States to an air base next to an academic medical center so they can provide trauma care. I want it in Cincinnati, will you help me? I said, I'll help you in Cincinnati if you'll help me in Shreveport. And now Shreveport is one of the medical centers in which the Air Force will evacuate people out of the battlefield, bring them to the U.S. for a level 1 trauma center. I worked at that. I make no apologies. And for people who think they're too pure to get in there and fight, that they're not fighting for you. I don't know what they're fighting for. I'm fighting for you.
Yeah, no, absolutely. Switching gears here for just a minute to the big, beautiful bill. You know, folks have been decimated economically, financially, coming out of the Biden administration, and they're looking for some relief. What can everyday Americans expect in 2026 with respect to the tax cuts that President Trump extended?
So, first, again, no tax on tips, no tax on overtime. Most people will not pay tax on their Social Security benefit. And by the way, the no tax on tips, a fellow from Livingston Parish called my office and said right now it applies to waiters and waitresses, but it doesn't apply to hairdressers or the people who wash your hair when you go in. I thought, that's not fair. And because somebody from Louisiana called me, now if you're a hairdresser or if you're doing that line of work related to it, you don't pay tax on your tips either. That's because I fought for that. So if you're in that profession, there's a lot of incentive for businesses to invest. And when businesses invest, they create jobs and they create competition for the worker, which drives up wages. One more thing, Lewis, you had spoken about something about carbon capture. The president signed into law agreeing to continue those incentives for those companies to do it. the people who criticize it. And by the way, if you don't want it in your community, you shouldn't have it. But if you want it, let's support it. And the president very much is in support of that. I'm with the president.
Senator, it may not be fair. We got about 30 seconds, but could you talk quickly about your Support Act and the Halt Fentanyl Act?
Halt Fentanyl Act, the president signed it into law. It's my bill. Support Act is my bill. One gives law enforcement more tools to fight the criminals. The other supports people coming out of addiction. Both my bills. The Halt Fentanyl Act, I'm standing directly behind him. The president says this will be one of the most important bills we sign all year. Had another signing ceremony for the Support Act. The president and I working together to stop the fentanyl flowing in and to support the people who are already addicted.
All right, Senator Bill Cassidy, it's been our pleasure to have you here on the first edition of the App on Sunday. Thanks a lot, sir.
Hey, thank you both.
All right, Senator Bill Cassidy back with more of the App on Sunday. We'll put a bow on this one right after this. All right, that's gonna just about do it for the first episode of the App on Sunday. Louis Avallone has been our co-host. Thanks for taking part. We appreciate it.
It was a pleasure. Absolutely.
All right, Louis Avallone, American Ground Radio, Monday through Friday on Keel Radio.
Absolutely. 710 AM, 101.7 FM.
All right, that's it for now. This week on ABC is coming up next. Have a good one.
You've been watching Arklatek's People and Politics. Thank you for joining us. Presented by KTBS.